Have you noticed that your body is speaking up more insistently in midlife? Have you wondered what the relationship is between perimenopause or menopause and new or worsening pain, fatigue, or symptoms? Symptoms that once came and went and now linger? New symptoms like pain, tension, digestive issues, heart palpitations, dizziness, tingling, fatigue, even though your medical tests may come back normal. And yet something clearly feels off. I'm Madeleine Lowry, a neural retraining specialist, and today I want to talk about why physical symptoms so often emerge or intensify in midlife, and why this is not random, imagined, or even a sign that your body is failing you. In fact, these symptoms often represent a call to action, not a malfunction. For many women, midlife is the point at which the body stops compensating. For years, often decades, you may have overridden signals of stress, exhaustion, grief, fear, or unmet needs. You kept going, you adapted, you held it together, and your body cooperated until it couldn't anymore. The nervous system is designed to protect you. When emotional stress is persistent and unresolved, the system looks for other ways to express that burden. If emotions are suppressed or minimized, the body often becomes the messenger. This is not because symptoms are psychological in the dismissive sense. It is because the brain and the body are inseparable. Think about it. When you are stressed, that is not just a concept in your head. It is a feeling in your body, a tightness in your chest or your jaw, a knot in the stomach, an increased heartbeat, headache, or shortness of breath. What we feel emotionally, we also feel physically. There is no separation between body and mind. Similarly, every physical sensation, pain, tightness, burning, fatigue, is interpreted and regulated by the brain. When the nervous system is stuck in a heightened state of vigilance or threat, the body reflects that state. This is why in midlife we often see chronic pain that has no clear structural cause, digestive symptoms that worsen under stress, autoimmune flares that correlate with emotional overload, cardiovascular symptoms that increase with anxiety, chronic fatigue and brain fog, or neurological sensations like tingling, weakness, itching, or dizziness. These symptoms are real, and they are not just about getting old. They are expressions of a system that has been under pressure for a very long time. What is important to understand is that the subconscious mind plays a central role here. The subconscious is where stress patterns are stored. It's where beliefs like, I have to be strong, I can't fall apart, I have to satisfy everyone, or there's no room for my needs, quietly operate. These beliefs aren't intellectual. They are embodied, and over time they shape your physiology. In midlife, hormonal shifts and reduced stress tolerance often expose these patterns. The body no longer has the same buffering capacity, so what was once held beneath the surface begins to emerge physically. Neural retraining works by addressing these patterns at their source, not by suppressing symptoms, but by helping the nervous system recalibrate. In sessions, we don't ask clients to figure out why they're sick or in pain. Your subconscious mind already knows. By working with memories, patterns, and emotional responses, we allow the system to identify and neutralize stress patterns that no longer serve you. When this happens, symptoms often soften, not because we're forcing a change, but because the nervous system no longer needs to stay on high alert, draining valuable energy and resources that could otherwise be used for healing. Many women describe it as feeling safer in their own bodies, less reactive, less fragile, more resilient. And this is critical. Healing at this level does not require reliving trauma or analyzing the past. It requires creating conditions where the nervous system can update outdated responses. Midlife symptoms are not punishments. They are communications. They are asking for a different relationship with stress, responsibility, and self-attunement. In the next episode, we'll talk about identity in midlife, how long-held roles, expectations, and self-concepts can quietly drive stress patterns, and what happens when those identities begin to shift. For now, I invite you to consider this question. If these symptoms were my body speaking to me, what is it that it is asking for? Listening may be the most powerful step toward healing. If you'd like to learn more, you can sign up for a free phone consultation or take our free quiz to learn if neural retraining could be your next best step at tcneuralretraining.com. I work with clients all over the world in private sessions via Zoom video conference. And if this episode resonated with you, please follow the podcast, leave a review, or share it with someone who needs to hear it. Thank you for listening. And remember, midlife can be the best part of life if we see it as an opportunity to slow down, listen, and change. Content of this podcast 2026 by Twin Cities Neural Retraining. Music by Barbara Ben.